Hello.
Hello there.
How are you?
I'm okay.
My name is Paige. I'm a nurse practitioner here at this clinic.
Okay.
Do you have any questions about what a nurse practitioner is?
No.
Okay. Can you tell me your first and last name?
Dolores McHugh.
Okay. And how old are you?
I'm 66.
Okay. Can you tell me what brings you in today?
I've just had this pain in my lower left side for like 2 to 3 months now.
Oh, okay. You said it's happening for about 2 or 3 months. Is it constant or does it come and go?
It comes like every 2 to 3 days usually, and it's on the lower left side, but it feels like kind of crampy, and it comes and goes during my episodes.
Mm-hmm.
And usually if I have a pretty good bowel movement, it goes away.
Okay. All right. Sounds good. Can you describe it if it's sharp, shooting, burning?
It's just crampy and like a gas pain, but like if I'm doing something, I have to stop, and it usually lasts for like 15 to 30 minutes.
Okay, all right. Does anything relieve it besides having a bowel movement?
No, I do take a laxative. I think it's called Correctol or something.
Okay,
1 to 2 times a month if I don't have a bowel movement in 3 days, so I'll take that.
okay. How often would you say that you're having bowel movements?
Probably every 2 to 3 days.
Okay. Are they formed, loose?
They're formed and they're hard and they're brown. I usually don't see any blood in them or in the toilet or anything.
Okay, no blood. Alrighty. Any past history of constipation or problems with loose stools, hard stools, things like that?
My bowels have been pretty regular for, as long as I can remember. So I've never had a normal bowel pattern. And I usually have to strain when I go to the bathroom, so it's not a good time.
Okay, alright. Do you take any medications besides that bowel medicine that you mentioned?
I do take lisinopril for my high blood pressure.
Okay.
But it's well controlled. I take it pretty regularly, 20 milligrams a day. And then I also have asthma that I get, it flares up 1 to 2 times a year.
Okay.
And I take a inhaler for that.
Okay, maintenance inhaler or a rescue inhaler?
Both.
Okay. So the lisinopril, you said it's 20 milligrams daily?
Mm-hmm.
Okay. And you take that every day?
Yep.
In the morning or at nighttime?
In the morning.
Okay.
For breakfast.
And then do you know the names of your inhalers?
My rescue one is Proventil,
Okay.
I think. And my maintenance one is Advair, I think.
Okay. And do you take that once, twice a day? How often are you taking that?
Twice a day.
Okay.
1 puff twice a day.
All right. Any over-the-counter medications that you're taking?
Just the laxative that I mentioned.
Okay. All right. Sounds good. Does your abdomen feel like it's bloated, kind of large feeling? Any nausea or vomiting? Okay. So not when you're having that pain, you're not having any nausea or vomiting
No,
either?
just that weird bloaty feeling, and I feel huge.
Yeah. Do you have any allergies to any medications? What about anything in the environment?
Mm-mm.
Any food?
Mm-mm.
Any medications?
No.
Okay. Any latex?
Nope.
Penicillin?
Nope.
Okay. Alrighty, so we went over your medications. Can you tell me a little bit about your past medical history? I know you mentioned the high blood pressure and the asthma. Anything besides that?
Nope, I've never had any surgery, never had any accidents. All my immunizations are up to date.
Okay. Alright, so going back to your asthma, do you have any exacerbations?
What are those?
Where it gets worse throughout like a time where you have an asthma attack?
Yep, so 1 to 2 times a year.
Okay. Alright, sounds good.
Ish.
Do you know when the last time one of those happened?
It's been a long time. I don't.
Okay. Have you had your flu shot this year?
Yep.
Alright. Do you know if you've had the pneumonia vaccine?
Yep, all my immunizations are up to date.
Okay, so the Tdap and,
Yes.
okay, very good. Any family medical history for gallstones?
No.
Celiac disease?
I don't think so. I'm not really sure what that is, but I don't think so.
IBS? Irritable bowel syndrome?
No.
Okay, sorry, I shouldn't use those terms.
It's okay.
Alrighty, so are you married?
No, I'm single
Okay.
and I'm not sexually active.
Alright, do you have any children? No? No children. Okay. Alright. Do you drink any alcohol?
Nope.
Use any tobacco products?
No, ma'am.
Any recreational drugs?
Nope.
Alright. Any caffeine?
Yeah, I drink like 4 cups a day because I work nights as a store manager at Marriott.
Okay.
So, just
And
getting through my shifts.
4 cups of coffee?
Mhm.
Alright. Are those the big travel cups or just like
No, just like a cup.
just a regular old cup? Okay. So let's go over just some basic review of everything in your body. Any dizziness?
No.
Headaches?
No.
Any recent fevers?
Mm-mm.
Any changes in your weight?
No.
Okay. Any skin changes that you've noticed? Any new lesions, rashes, moles? Any change in your skin color?
No.
Okay. All right. Do you know when the last time you had a menstrual period?
Like 15-ish years ago. I've gone through menopause.
Okay.
So,
Do you know when the last time you had a pap smear was?
2 months ago, and it came back normal.
Okay. Have you ever had any abnormal pap smear?
No.
Okay. Any shortness of breath or chest pain?
Nope.
Can you tell me a little bit about your diet?
Well, because I work nights, it's really hard to eat like
Yeah.
whole meals. So
Mhm.
I eat a lot of like high carb foods, and I don't eat very many fruits and vegetables.
Okay.
And I eat like a lot of high calorie foods.
All right. Sounds good. And you already told me that you haven't noticed any blood in your stool. Have you noticed any hemorrhoids?
No.
Okay. Any painful urination? Any blood in your urine?
No.
Any frequency with urination?
No.
Okay. I'm going to take your blood pressure, pulse, and temperature, and then we'll go over to the exam table and kind of finish up. Can you tell me how tall you are?
I'm 5'5".
Okay. And how much do you weigh?
I'm probably like 135.
Okay. Can you put your wrist up here and put your feet flat on the floor? Thank you. Good, 72. And I would normally roll up your sleeve to get this blood pressure. All right, 118/82.
Pretty good. With my blood pressure.
Looks like that lisinopril really is keeping it well under control.
Yeah.
All right, have you had anything to eat or drink in the last 10 minutes? All right, let's put this underneath your tongue. All right, good, 98.2, no fever. All right, I'm gonna have you go sit down on the exam table. I'll have you stay upright first.
Okay.
All right, I'm gonna listen to heart and lungs first. All right, can I have you take a deep breath? Good, and over here? Good. Perfect. Good, and then over here, deep breath. And just regular. Very good. All right, I'm going to help you lay down, and then we're going to take a look at your abdomen, okay?
Mm-hmm.
All right. So I'm going to lift up your shirt here, and then I'm just going to take a listen, see what I hear, okay?
Okay.
Okay. Don't hear a whole lot going on in there. Sounds like the bowels aren't moving around too much. First, I'm just going to lightly palpate, and then just a deeper palpation. Let me know if there's any tenderness, okay? All right. Any pain when I'm doing that?
When we first did it a little bit.
Okay. All right, so kind of on the lower side. All right. Now deeper. Any pain when I'm doing that?
Yeah, a little bit.
Okay. Okay. Pain there?
Just in the beginning.
Okay. All right. I'm going to go over on the other side and I'm going to feel for your liver. Just to make sure that that's not enlarged and that's not going to be the cause of the pain. Okay? All right, so I'm going to have you just put your arm up right about there. That's good. I'm going to put my hand underneath here. All right, I'm going to have you take a deep breath in and then out. Good. Okay. And then here, can you take another couple deep breaths? Okay, good. I'm going to come back on the other side and feel for your spleen. I'm going to put your hand up here again. Perfect. Lift up a little bit. Okay. All right. And is there any tenderness on either side when I'm doing this? Okay. All right. Very good. I'm going to help you sit back up. So can you tell me what you think possibly is going on that's causing the pain and the constipation?
I think I feel like it's some cancer or something because it's happened for so long.
Okay, all right. With the diet that you eat and the symptoms that you're having where the pain is in that left lower quadrant, I'm thinking it could possibly be diverticulitis, which is a bit of an inflammation in the pain usually manifests in the left lower side. We are going to do some routine lab work. I'm also going to get a stool sample. We're going to check to see if there's any blood in your stool, and we'll go from there. And then I'm going to order a colonoscopy, if that's okay with you, starting around the age 45, 50. Those are usually done every 5 years, as long as you're not getting any abnormal lab results, or I'm sorry, test results with that. And we'll go from there. Also, I'm going to give you some diet information about increasing the fiber in your diet and decreasing the fats, kind of with the fast food and eating those little meals on the go. I also want you to try to increase your water intake. Always keep a water bottle with you at work. Any questions about the plan or the assessment today?
No.
Okay. Any questions about anything else or any other concerns that you have with your health?
No.
All right, sounds good. Thank you.